We knew you as more of an academic than a clinician over our years, as an analyst on so many things at Indiana University. And now you're the president of AcademyHealth. And I'm thinking that your job is taking a different direction than maybe what you thought it would, given Trump's election, more specifically the funding cuts that you and your colleagues and all of us care so deeply about. Is that fair to say?
I don't know that I would say that the job is not what I expected it would be. I think that the focus and intensity has just ratcheted up enormously in the last 2 months. Has that been 2 months? I've lost track of time, it feels like. For instance, we were working on a strategic plan starting in June, and we're just finishing up now, and it has not changed, because I think we were already anticipating some of the changes to the field and how we needed to think and talk about data and evidence in order to help them have a huge impact. But the massive sort of chaos and uncertainty of the last 2 months with respect to funding and executive orders and research and academic freedom, and all of that has just been upended in such a way that it has made everything intense and difficult. Uncertainty is almost one of the worst things you can have in the field of research, because, as we've talked about many times, it's hard. It takes real money and resources. It takes a long time, because you have to set it up, recruit people, do the thinking, double check, triple check. And when there's so much uncertainty about whether your funding could just be cut midstream, and for a lot of people it just has been, you can't just stop and start again. It puts everything out. It's sometimes difficult for organizations to make payroll. It takes a certain amount of expertise and skill. And once disrupted, it's very difficult, if not impossible, to put it all back together.
What are the most imminent or serious consequences that you've seen so far in terms of cuts to funding? You mentioned the main general concern is uncertainty with whether your project, your grant, your work is going to be able to continue ever, if even start. But it would seem like these cuts to USAID or cuts to Columbia or Johns Hopkins, cuts to academic research that have already been done. It's hard to know if they are going to be clawed back, is a phrase we're learning. Yep. But what are the most serious consequences you've seen so far to these cuts that seem to be done without any understanding of the consequences?
So that it's hard to rank them, but I think you brought up a couple that serve as prime examples. Certainly the USAID cuts are going to have real world impact on the lives of hundreds of thousands, if not millions of people living in developing countries. These were programs that were trying to do serious good. And some of them, like PEPFAR, are like the President Bush's probably most significant achievement.
Why should I care about kids getting AIDS in Africa or Ebola in Africa? How does that affect me?
Well, why would we not care, first of all? They're human beings.
Well,
the idea that a human being that lives in another country is somehow less than a human being that lives here, just because of the luck of where they were born, is hard to swallow. Especially when, for so many of these things, we can solve these problems. There are diseases we can treat. And it was just about getting the stuff there. And we're just saying no. It's not as if it's impossible, or if it's a competing priority of if they get the treatment, we don't get the treatment. No, it's we can do it.
Although I
think
think
hard to swallow. But on top of that, when you talk about that's perhaps more HIV, but you're picking even infectious diseases, even if you don't share the ethical idea of that human beings are worthwhile to save.
Right.
Do it because it's in your self-interest. Treating a disease over there prevents it from coming over here or spreading. COVID was terrible. I don't think we want that with Ebola. It's just, we don't need. Do you remember how the world almost shut down? I think President Trump was president. Was he? I can't even remember. Maybe it was before he was elected, when we thought there might be one case in the United States.
I think Obama was in office when.
But I think Trump was screaming, shut it all down.
Yeah.
And because there might be one case of Ebola here. It's maybe it's a better idea for us to continue to fund taking care of it elsewhere before it gets back here again. There's just so many good reasons for that. But but what I actually want to talk about, just even the scope of it, because if you immediately stop funding all that infrastructure over there, which really in the scheme of things, not that expensive, those people go away. they have to make a living somewhere else. The nonprofits that were the intermediaries can't make payroll, they go away. And so even if a month from now you're like, you know what, I'd like to re-up that again, the cash has nowhere to go. Like where it's all that infrastructure, all of the supply chains, all of the things about we need to pay for the food and the food goes here and then we move it there and then we move it where it's spoiling on a dock somewhere. It's not like you can just fix everything with money by turning the spigot on and off. Again, this stuff takes time to build, time to get going, and you got to keep it going. If you want to make changes, you got to be thoughtful about it. You don't just pull parts out of planes while they're in midair because you think you just need to make cuts.
What about the academic research? You said
what's happening at like some large institutions and even smaller scale, it's also the same kind of thing. It's like, look, I was very dependent for a long time on federal funding for my research. And this is not a woe is me, everything I value. And I always used to preach to my junior faculty who would complain sometimes it's hard to get funding. Like, it's supposed to be hard. Like, you're actually asking for taxpayers' money, hard-earned money, to give to you to enact your whims to see if maybe you're right. Now, you've got altruistic goals and that's all fine, but it should be hard. It should be a competitive process. And I'm all for that. And I'm all for reforming it and making it more rigorous. But if you were to immediately have cut all of my funding off midstream, forget even putting my job at risk, everyone who worked on all those projects would be fired because that's what paid their salaries. Most of the grants go to salaries. And the same thing goes when you're conducting cancer research. Like, you can't, if you stop paying people, the lab technicians get fired. And often the lead scientists, if they can't recoup investment, they're going to get fired. And then what do? And you're not going to train new people. You're just going to gum up the entire machine. And it's incredibly hard once you've destroyed it to rebuild it.
This is easy to message against because, and you've taught us this years ago, they cherry pick a study and then generally speaking, they misrepresent it, like transgenic mouse versus transgender mouse, or they make a study sound frivolous because it's being done on mice or caterpillars, but the end product would be some kind of potential genetic miracle or something like that. So,
I mean, we can laugh about it, but I can't remember the exact thing, but it's something like lizard spit. I can't remember exactly what it is that turned into Ozempic. Like, it's just like, if you looked at the original studies for what eventually became Ozempic, these would be prime for making fun of. Like, why are we looking at this? Because you don't know ahead of time where this stuff is often going to lead. And that's how it goes.
How do you message against that? When you hear somebody going on television, Republican congressman, and rattling off these ridiculous sounding research projects, I feel like messaging against it would be simply listing, as you just said, any number of projects that were funded that came to miraculous conclusions, therapies, drugs, etc. But it's not very easy to message, and they can demonize and demagogue even NIH, much less every other.
And the thing is, it's like, all you got to do is go in and read the grants, because if you apply for it, if it's not like you just show up at the NIH's doorstep and we're like, hey, I got an idea, I want to study lizard spit, and they go, fine, here's $1 million. Like, you got to write a grant. It's hard. It takes a long time and it's complex, and you have to like really justify the background and why you're thinking of doing this study. And you got to lay out there all the reasons why this is the way that you should go. And you have to talk about the methods and specifically what you're going to do and what's your environment and why you're the best person to do this research and why your institution is really good. And here are your partners with letters of support explaining it. And you got to show your past track record and why this is going to go, and all the pilot studies that came up to this to show that this is really a good thing. And then you're competing against tons of other scientists doing exactly the same thing. And then they pull a bunch of really good scientists together to read these things and judge and debate, and then create a list of like, these are the most promising, these are the mid ones, these are the least. And you vote and you score it, and you rarely get funded on the first try. You get all this feedback back. These are the concerns we have. And then you go back again and they pull in research and they evaluate. And finally, by the time you get funded, it's been vetted amazingly. So again, you could talk to any of the people that took part in that process and they say, why are we funding lizard spit? And they'd be like, oh my God, this is why. And they would rattle it, but they don't do that. They just read the title, the least important part of the grant, the part you spend the least amount of time working on. because who gives a crap what the grant is called? And then they get rid of it. But it's like, it had to go through so much rigor to get there. Now, if you have a problem with the rigor and you spot flaws, or by all means, we should fix that. But to just throw out the ungodly number of man hours and actual resource dollars that went into the judging and vetting of all that research because you just want to, like, you just created more waste than you could possibly hope to be preventing.
That's a really good point. Yeah, look how much waste you actually just created and didn't prevent any at all.
Yeah.
You mentioned academic freedom. What does that mean? What are your concerns?
Well, part of it, the whole way that we've built up the research enterprise is that you don't want people only doing research which is politically loved at the moment, because you just don't know. You have equipoise going in an ideal world. You don't know what the results are going to be. You don't know what you're going to find. And you're not doing an agenda. You're trying to figure it out. Years ago, everything seemed to be stem cells, and there was a political agenda against stem cells. And to be honest with you, I haven't heard as much about stem cells recently. But is that because good science found that stem cells are not a good thing to work with? Or is it because a political agenda killed that line of research? I don't know the answer. I'm just not an expert in that. But you don't want people only getting to do ideological work. It gives you tunnel vision, and you're going to miss all kinds of potential advances and things that might be different just because you're bucking through. And I don't even mean just politics. If we only allow research, for instance, if we only said that we could do research which followed a certain stream of even thought about like how Alzheimer's works or how cancer works, and we only said, hey, only if you follow these rules, like these ideas, are you going to get your cancer funded stuff. What if there's another promising lead that just doesn't? You need to be able to think outside the box. You need you need to be able to think outside the orthodoxy, make a good case. And if you can convince, again, that whole machine that your ideas are worth funding, by all means, we should fund it. And someone might make money off of it if it's a drug. It's like you're killing the economic engine, you're killing research in general, you might be preventing life-saving things. Like, why muck with this without at least engaging with people in a transparent manner about what your goals are and trying to achieve efficiency or improvements? And I'm fine with that. But just to behind closed doors, without talking to anyone, just wipe everything away, it benefits no one.
On the political point, it would seem that there's some concern for those who are doing research or working with mRNA vaccine technology. Are you familiar with this story? The NIH, because it's for treatment of infectious diseases, including flu and AIDS and cancer, and for whatever reason, they're being told maybe just don't mention it. It seems like researchers and folks who are trying to do good work are trying to find ways around certain references. The scientists say that officials from NIH urge them to remove references to mRNA vaccine technology. What's the deal here?
Well, if you've become radicalized against the pandemic in such a way that you think that mRNA vaccines are a terrible thing because you've been told that they cause untold damage and all that, and again, if you believe that, then there are people who think that the technology is evil, or that it rewrites your genetic code, or that it causes more harm than good. And for political reasons, you may choose to rally a crowd that believes that and convince us that it's not a promising area of research, or that we shouldn't be funding it, or you liken it to gain of function research, which may have caused the pandemic or may have led to SARS-CoV-19. We don't know. But the bottom line is it's a good example because it's an incredibly promising technology. There have been some really interesting studies showing that mRNA developed work might be helpful with pancreatic cancer, for which we have very little comparatively. Why would you want to squash that research? Why would you not want that research to occur? It's mind-boggling to me. People who, without the transparency, without the discussion, without the involvement even of Congress, we seem to be making decisions in a very tiny room with no sunlight about what can and cannot be done.
Yeah, that's the hardest thing, is that there's just no transparency as to how these cuts are being made, if there's any strategy at all, which there doesn't seem to be, other than actually citing certain words. Like certain things are getting cut accidentally because of word searches.
Yes.
It would seem.
Yes. Yeah. And it's like, and some of it makes no sense because again, I feel like every paper that I have ever written has the word bias in it. Why? Because I have a canned line that I use like in my limitations section, which is always like this research, like all research has biases that warrant further consideration. This might be true. That might be true. It has nothing even to do with race or gender. It's a word. It's bias. But if you were to do a word search on me and say like, we got to delete every paper with the word bias, and like everything I've ever done, which not very little of it focuses on DEI, gone. And it's like, this is where it gets silly. These are just words. Like they have meaning. And so to do a control F search and make that the means by which you decide what funding should get canceled, if it's a disease into sickle cell, and within that, you acknowledge the fact that sickle cell disease is far more prevalent in the African American population, does that mean it gets deleted because it has the word race in it? Like, I don't know. It's madness.
What about the Health and Human Services Agency? It's obviously now, I can't believe this because we've been talking, you and I, for so long about all kinds of issues. And now RFK Jr., who was on the fringes along with a whole bunch of other anti-vaxxers, anti-science folks, I'd argue, he's in charge now of the federal government, the biggest agency. And now you've got this measles outbreak. More people have gotten measles this year than all of last year combined, or more people have died. It's like over 300 now. And you've got the bird flu situation. RFK's suggestion, by the way, is let it go. Like, let the chickens, just don't kill them, don't cull them. And I read a whole article about it. And of course, I guess it was the New York Times. They refer to a biologist and an economist and an agriculture expert and so on. And then you get done reading the article, you're like, I don't think the guy in charge of HHS, who could talk to anybody he wants, asked anybody their opinion.
Okay. So we should like acknowledge that the head of HHS is an administrative job. He is not in the lab doing the research. So in an ideal world, I agree with you. He may, if like asked off the cuff, offer an idea. And let me tell you, it's like, he's not the first person to vocalize that. Now, I believe that if you asked a bunch of people who are knowledgeable in the field, they could probably give really good answers as to why that's not our best option. And there are other things we should do. But I don't want to demonize the idea or the fact that like we should be able to just recognize that like we need to have these, and I want to encourage having these conversations in public. So this is where I'm not going to just start railing against RFK. He's got an important job. It is my goal that like we continue to work with HHS and we continue to have funding for research and we continue to do good things. And we only do that by continuing to have discussions and providing the best data and evidence and using science to offer up good options for steps that we can take. In this case, I bet that there are really solid arguments against not doing that because it could lead to catastrophe. But let's have those conversations and let's do it in a way that's convincing and gets the job done. That I'm all for. What you see me get heated about is when these things are being done in a room with like 3 people. I have no idea who they are. There's no discussion, no understanding, radical action. That's the problem. Like we've had administrations with beliefs go one way or the other. We can have discussions, we can pull the levers, we can have congressional input, we can have hearings which help bring data to light or evidence to light. We can do all of those things and we can make change, but that's not what's happening right now. It's so much black box.
And to the measles.
Look, there's no question in my mind the best way to prevent measles is to promote vaccination. I've been unwavering in that. And I think we absolutely have to keep countering misinformation about vaccines in moving forward. And I don't ever want to minimize the outcomes, but like still the vast majority of Americans are vaccinated against measles, mumps, and MR. And we need to work on getting more people. We do that by continuing to build trust. We do that by continuing to answer questions and counter fears and do that. That's too rarely what actually occurs. It's like people screaming and yelling at each other and talking down and saying the other's not listening and that they don't understand. That changes 0 people's minds, no behavior. And so, yes, we need to work on improving uptake of the MMR, especially in certain populations. But but we're not going about it always the right way.
How about this? The White House yesterday removed advisory defining gun violence as a public health issue. Webpage listing statistics and information on shootings taken down as Trump seeks to, quote, protect the Second Amendment. Talking about gun violence as a public health issue was, I think, meant to take the temperature down around this obviously controversial American issue of gun ownership and so on. But it's like the leading cause of death in adolescence or something like that. The idea of obfuscating something for political purposes, in this case, removing an advisory defining gun violence as a public health issue. Is that problematic, or is it just like political, like, are, you know, they're just doing this and they're appeasing the gun rights folks, but we're still going to be working on this issue and thinking about it as a public health issue?
I think there are tons of people that are going to continue to work on this issue. It has not been a focus of much federal funding. It's much more privately funded. I think that will continue. Erasing the data doesn't change the reality. All of those things are true. But I imagine this is more about political action than it is real action. There's plenty of data. There's lots more that can be done. But it's, again, another example where I think we have to do a better job of communicating the risk and also what we can do to mitigate the risk. And there are lots of different ways and lots of great people doing research in how do we make things safer. We can't let the perfect be the enemy of the good. In public health, so often more is better than perfect. And we need more gun safety. We need, more education. We need perhaps laws that make it so that guns don't get into the wrong hands. There's lots of things we can do. And I totally agree. Hiding data, taking data, we are against removing data. Even the mission of our organization is to promote and encourage the use of data and evidence to improve health and healthcare for all. More data, more information, more knowledge is always better, period. And I wish that we would not politicize any issues with respect to trying to improve people's health.
For years, the Medicaid program, well, since its creation, it's been controversial. We've talked about it so many times. You know how the program works as well as anybody. What they're trying to tell us is there's a lot of waste, fraud, and abuse in Medicaid. They want to cut that. But what they're really going to likely do is cut the actual benefits of Medicaid. What do you want to say about this issue? What are your concerns around Medicaid cuts?
Yeah, I'm sure that there's waste, fraud, and abuse. I'm sure that the number is greater than zero. I can tell you that none of the proposed actions that I've seen will get at that or try to reduce that to zero. Instead, it's trying to make either new proposals for things like work requirements, which really just lead to red tape, which cause a lot of people to drop out of the program or lose their coverage because it's very hard to maintain and prove that you deserve it, or by passing the buck to states and saying, we're just going to give you less money, figure it out. And the only way to figure it out, of course, is to really cut benefits or to cut coverage. There's no magic in this. Medicaid is already super lean and super cheap. Private insurance costs more because it does more in the United States of America. So none of the proposed examples, which will to how we reduce Medicaid spending, are going to not have major consequences. They're either going to affect access, quality, or, you're reducing costs, so it's going to affect access or quality. And I would love to have, again, open, honest conversations about what these would do and why, but we're not even having those debates. It really feels like at a congressional level. A lot of this is pass the buck. We'll decide later. We'll figure it out. Oh, we're not going to cut that. We're not. You got to cut something. It is simple math. If you need to remove hundreds of billions of dollars from Medicaid, it's going to come by definition on a huge amount of Medicaid spending is spent on kids, pregnant women, disabled people, and elderly people. That's the vast majority of it. So which group of those four do you want getting back to work? Or It's like, what are the work requirements going to do? None of those people by definition should really be working. So I don't know, or may not be able to be working. So there is no good answer for where does it come from?
I say put the kids to work.
Well, don't get me wrong, that's been proposed, but we'll see.
All right. Well, we'll hear more from you out in Las Vegas. Very excited to see you in the flesh and really appreciate you joining us today. Thank you very much for joining us. Keep up the good work at Academy Health, and always grateful for your time, my friend.
Anytime.